So that's my disclaimer. I'm Prasenjit Mitra. I'm a professor at the College of Information Sciences at Penn State University, and I will be your moderator today. So with that, this panel is on synergistic AI and government response for COVID-19 as part of our conference today, a virtual conference on AI in a post-COVID world. And the panelists, I'll just briefly introduce who you are, but I will first ask all of you to make opening statements, and please tell us a lot more. I know each of your bios are much bigger than what I will say, so please tell us who you are, what you have done, anything interesting, and then we have a set of questions that have been shared with you. We can go with that, or we can be more free-flowing. If any of our guests and attendees want to ask questions, please feel free to ask questions. Just a reminder for those of you who have been here, you know this, but the others, if you want to ask a question in private to the panelists, please use the Q&A. If you post something in chat, we will monitor that and ask our panelists those questions, as well as everyone else will be able to see your questions. And if you ask a question, I will try to promote you to be a panelist temporarily. If you want to ask the question in person, you can also raise your hand and we will promote you to be a panelist. You can ask the question, have interactions, and then, well, then you'll be demoted again. I'm sorry, because ideally we would like everybody to be in the same room, but because of Zoom limitations, we have to go with this webinar format and panelists and so on. With that, let me introduce our panelists. Our panelists today are Professor Nita Bharti, who is the Huck Early Career Professor at Penn State University, and she's also an assistant professor of biology. Dr. Professor Matthew Ferrari, Director of the Center of Infectious Disease Dynamics, again, a Huck Career Development Professor and Associate Professor of Biology. We have Dr. Olly Oeschle, Senior Engineering Manager at benevolentAI, and we have Professor Aditya Prakash, who is an Associate Professor from the School of Computational Science and Engineering at the College of Computing at Georgia Tech. And last but not least, you heard him during this morning's keynote, Professor Roozbeh Sadeghian, Associate Professor of Analytics, Harrisburg University of Science and Technology, member of the Pennsylvania COVID Task Force on Rural Health. And with that, I would ask, we will go in alphabetical order initially, and I will ask Dr. Nita Bharti to make an opening statement, introduce herself and her work and get the panel going. Nita.
Hi, thank you for that introduction. It's nice to be here, and thanks for inviting me, Amelia. I am a member of the Center for Infectious Disease Dynamics, and my group has been working on understanding behavioral aspects of COVID restrictions and COVID interventions. And we've been using some AI tools that we'll probably talk about in this panel. But we've been looking largely at compliance with movement restrictions and different tools, developing different tools to do that. So nice to see everybody.
Thank you. Our second panelist is Dr. Matthew Ferrari. Matt.
Hi, everybody. So I am Matt Ferrari. I'm the director of the Center for Infectious Disease Dynamics, which means that I help to oversee and organize a huge collection of infectious disease researchers at Penn State from all across the university, from biology, computer science, mathematics, statistics, entomology. And try and bring together a lot of diverse perspectives on how infectious disease works, things that we're normally doing in non-pandemic times, and we've been helping to coordinate their response in pandemic times as well. I've also been through my research in the dynamics of infectious disease, the estimation of disease burden, and the evaluation of vaccination campaigns around the world, mostly for childhood vaccine preventable diseases. I've worked with a number of government organizations and international organizations, the World Health Organization, US CDC, and then a number of crisis response organizations, Médecins Sans Frontières and Save the Children, in the use of vaccination in outbreak response and the evaluation of those efforts post hoc, so that we can learn from what's effective, what's not effective, and how we can improve operations and response strategies going forward. In my most local role, I've been an advisor to the Penn State administration on their COVID response planning.
I should unmute myself. Thank you. And is Olly there? Yes.
I'm here.
Okay. Yeah. So yeah, our next panelist is Dr. Oeschle. Olly, please go ahead.
Thank you. Yes, hello everyone. My name's Olly. I'm calling over from London, representing a company called benevolentAI, where we use artificial intelligence, machine learning, and big data in the field of drug discovery. And we generally take our own treatments through to the clinic with a combined team of technologists like myself and scientists. But during the COVID-19 pandemic, we looked at our compendium of data, our knowledge graph, to see whether we could use that to find any therapeutics in the face of the pandemic as it was emerging in January 2020. And we identified some key mechanisms involved with the progression of COVID-19 using our data and using our scientific expertise, and identified a rheumatoid arthritis drug that could be repurposed for the sake of treating patients, both as an antiviral and in terms of helping with the inflammatory response that characterizes the disease. We published that in February of last year, and it was quickly picked up by various research organizations around the world. And of course, its owner, Eli Lilly. There were large-scale clinical trials throughout the year to assess its value as a COVID-19 treatment. And the large Act 2 trial showed that it was effective and reduced deaths by some 38% when combined with remdesivir, the current standard of care. And so it has emergency approval now in various countries around the world.
All right, thank you for that introduction. And our last panelist is Professor Sadeghian, Roozbeh.
I think you've skipped Aditya.
Oh, sorry. Yeah. Yeah.
That's fine, Prasenjit.
Sorry.
So, sure.
Yeah,
so,
I should know how to. Yeah, please go ahead. Thanks.
No, that's fine. So thanks, Amulya and Prasenjit, for the invitation. I'm Aditya Prakash. So I'm, as Prasenjit said, I'm a computer science professor here at Georgia Tech. So I come from a very computational lens, and I love data. So that's what we have been really involved in trying to bridge data-driven models with modeling and like the traditional computational epidemiology perspective, right? And that's what we are really interested in, and how data can help answering public health questions. So we have several projects in the past 1 year as part of the COVID response, touching different aspects of this pipeline where data can help. So one of them is forecasting, which we have been working closely with the CDC group on. So we have been involved in flu forecasting for quite a number of years, and that naturally transitioned into COVID forecasting. So we have one of the, I think probably the only deep learning model in the top 5 for over a year now consistently. So that's and then we have been also involved in trying to do interventions, how to do scenario forecasting. And so we have been involved very closely with the Georgia Tech administration for the campus response. So we have used Wi-Fi data sets and mobility data on campus to understand more localized and more targeted closures rather than broad shutdowns. So that's another part where we have been very closely involved in. And also we have been involved in hospital-acquired spread of COVID, and also its relationship with MRSA and C. diff. So we have been involved in modeling and understanding how at multiple hospitals, how these kind of things can spread, and what kind of patient treatment regimen changes needs to be done from an epidemiological viewpoint, which can help control these diseases. So, and at the other end, at the layperson perspective, we have been also involved in a lot of communication, which I'm sure a lot of our panelists also are acutely aware of, right? That to communicate our results and also explain our results to the public, to understand what's going on and what we are doing to as part of the response. So we have been involved in visualization, dashboards, trying to design the data collection tools, right? So the whole gamut of these kinds of things. So yeah, excited to be here. Thanks.
Thank you. And finally, this time I got it right. I think it is Roozbeh Sadeghian.
Hi, thank you. Thank you for having me. I'm so happy to be in this great team. I'm an associate professor of data analytics at Harrisburg University. I mostly teach machine learning related courses. My background has been more on speech recognition and detecting healthcare disorders in using speech related features, like using speech recognition for Alzheimer's disease diagnosing or speech delay in children. But I've worked in different areas of using machine learning techniques, from like conventional techniques to deep learning, to diagnose different healthcare disorders. Starting from the pandemic, I had this chance to join a great team of the task force of addressing this pandemic crisis in a rural area of Pennsylvania. And that was a great opportunity for me to see the problem from a different perspective, because we have worked in different areas, different problems that we are dealing with. But working with this specific area showed me that many of my assumptions and our assumptions have been probably not that much true. And we had to see the problem from different perspective too. And down the road, hopefully we're going to have, I'm going to have this opportunity to talk about it. But before I start, I have to apologize all the panelists and attendees. I have a last minute meeting came up and I have to leave at 2. So I do my best. Just I'm going to enjoy your talks by then. Thank you.
All right, thank you. So then you can go first with the next question. And so I think, I think Amulya sent out a very good set of questions, but I like to shake it up. So I'll improvise and ask you a question, which is maybe not in the list exactly. So the question that I have is, what is the most important lesson that you have learned in your work in this crisis, and/or what is the most important impact that your work has made, in your own words? And if you cannot choose one, you can say 2 or 3.
Yeah, actually in the morning session, I talked a little bit about the biggest lessons that I have learned. And there are a few of them. First of all is there's a huge bias in our models that we don't pay attention to it because we're not aware of it. You know, for example, I have seen works that are working on allocating the medical centers that are more close to people when they want to like have access to medical centers, especially in cases like this pandemic. But when you look at another population, which is the rural population, then the story is going to be totally different. Then the factors that you consider for that medical education is going to be totally different when you talk about rural area. For many reasons, for density of the population, for number of population, for the age of them. I've seen that many people are working on providing telemedicine to the population. But the problem that we have in rural area is that most of them are like on elderly ages. We have more people that are 65 or more, and they are not familiar that much with technology. They are not comfortable with technology. For example, if you ask them to go for vaccination, they are not those people who have access to internet all the time. I mean, the infrastructure is not there, even if they want to use internet for like registration or these kind of stuffs. The first thing that I see here, it's just for AI and for other things, for all the data analytics that we use, and that is bias in our models. The other thing that I see is that we as AI scientists, we have the knowledge of like implementing the model. I can get the data and then I can implement my model, come up with a deep learning model that works perfectly, but that is not enough, because there are many aspects that need multidisciplinary teams. It's not just enough for me as an AI, me and my team, to just get the data and produce the model. That's not the case. We need to have people who are familiar with the medical area, the people who are familiar, for the case that I tried, for the population in rural area. So multidisciplinary team is another thing which is very important to my knowledge. And then finally is the education from both sides, from my team to understand it better, the problem, more comprehensive knowledge about the problem, and the end user, the consumer, how they want to use the product or what I provide for them. So education, I think, is going to be the third important thing.
Anyone else?
I can only add to Roozbeh's comment about the multidisciplinary nature of this. Certainly, what we found is that in coming up with a repurposed drug for COVID, which is not the business model of Benevolent to do that. We create novel drugs, but there's something in there about the way in which a system of data and AI models, etc., can interact with a scientist who can take it in different directions than the initial intent. And indeed, when you have events like COVID coming along that cannot easily be anticipated, let's say, in terms of the details of what's going to happen, that's an interesting thing to think about in terms of what kind of a system it is that you're building involving AI or other statistical tools or whatever, and what is the sort of generalization capabilities of it. And we talk about that a lot in terms of the models themselves, of making sure they generalize and they're not too specific on training data, etc. But there's also the idea that the AI can be part of a wider system, or indeed that the data produced by an AI system can then be used indirectly by a subject expert and do things beyond what you could do. So there's a lot of interesting areas, and when we start to think about AI models as, integrated into a wider system that can do stuff well beyond what you built it for.
So just a quick follow-up, Olly. What did you use your AI models for, and what type of models did you use?
So in this case, we used basically our data set of compendium of biology that we store in a knowledge graph. And so the AI models in here were principally ones for reading the scientific literature that allowed us both to build that repository in the beginning and also to be able to reread the literature when we realized that we needed to append a lot of information relating to virology, which isn't our speciality. And being able to do that rapidly was one aspect of the tooling was essential. We then came to understanding that data using more statistical models and other techniques for identifying the key mechanisms involved with this. And all of this was done with the insights of our scientists who were able to direct these questions so that we could go in the right directions with this. But nonetheless, with all of that in mind, we were able to do this in a matter of days on a system that wasn't designed it. So it wasn't an end-to-end AI system by any means, but a system with AI components and statistical learning and all of that in various different parts of it that could then be reused.
And so I'm just curious, how did you figure out which drugs to repurpose?
So we started off by appending what was known in sort of January, February 2020 about general coronavirus biology. And we used various sort of network analysis techniques to identify the likely mechanisms involved in this, which based on the data that we had pointed us both towards the viral entry into the cell, the endocytosis, the means by which the viral particles get into the cell and then reproduce and do their business, as well as the inflammatory response, which is quite marked in COVID-19. And so these things came out strongly for us as factors that needed to be accounted for. And we then searched through the approved drugs to find what would be out there that could have effects on both of these mechanisms. And the short list of drugs that we found, our scientists identified baricitinib, a rheumatoid arthritis drug, as being the one that would be most capable of doing that. And that's been shown in the trials to date.
Yeah, that's fascinating. And I could go on with more questions, but in the interest of time and fairness, I'll backtrack and give the other panelists to tell us about the most important lesson learned and the most important impact of their work. Who wants to? Yeah.
So I guess I think somewhat in response to this, I think both so in the first response, and I think even just a little carryover from the previous panel, was a discussion and emphasis on the ability to communicate the results of these kinds of analyses. And one of the real one of the beauties and the elegance of AI is that it often allows us to search out solutions that we might not have thought of on our own, right? And that's really fascinating and that's really fantastic. Unfortunately, in a crisis setting, having to then communicate to somebody a solution or an optimal control setting that is counterintuitive is fundamentally hard, right? And so in the drug discovery in a drug discovery setting, right, you wouldn't discover the drug product, produce it, and then give it to somebody. You might discover a set of candidates and then do a bunch of really good science to validate it, right? And so then you're actually using conventional, using AI for some discovery or maybe to thin the field, right? To take some things off the table. Right, and then you're using conventional methods to bring it to market or bring it to the consumer, and I think that's I think really trying to find the balance between those two things is critical, because the end user really needs transparency. They really need to see that they understand where this thing came from, that you can really show them mechanism, that you can really communicate where a solution has come from, and I think it's incumbent upon us to sort of use AI thoughtfully. And not really, and not waste a lot of time using fancy tools that are going to generate, suggestions or solutions that just aren't palatable to the audience that's going to consume.
Thank you. Aditya or Nita?
So yeah, I mean, I completely agree with, I think, what the previous panelists have said. Explaining and interpreting our results and predictions are so very important. And I think it has, for me as an computer science and AI person, I think has thrown up a lot of different intellectually stimulating research problems, right? The past year. I mean, every month was like, oh, this is a gap. This is something we need to study, right? And everything is like a PhD thesis. So for me, I've been really intellectually stimulated from a computer science viewpoint of so many different problems, which I think are worth studying and solving. The other thing was also how hard it was and how chaotic the situation was from a data perspective, from just getting things off the ground, right? I mean, I think I would not, somebody getting into this, I would definitely not underestimate the unglamorous work you need to do to make it happen, right? Like, because there's so much noisy data, the definitions of the data definitions across different sites are not similar. you need to be sensitive to so many different things to make sure that the end result is meaningful. And I think I think that's another reason why you should work closely with people, right, who are also domain experts and who are consumers of your predictions. I mean, let just, for example, let's say even our CDC work and also our work with our local campus authorities. I mean, we had to work really closely with them to understand what their problems are, right, and how our data-oriented ideas, like let's say Wi-Fi data, using them, what are the questions they are asking, right? What are the practical operational constraints they are dealing with? There is no point giving a theoretically cute answer, which doesn't really lead to anything at the end of the day, right? So in a crisis situation, definitely that I think merging that bridge or bridging that gap between theory and actually the operational practice is very important. And you need to do this in really short time and a short turnaround time. So I mean, that's what I tell my group, right? I'm very proud of them that this is a really tough thing to pull off, and I'm sure for all the volunteers and scientists for the last 1 year, it's incredible, and people should not underestimate the amount of that background work needed to just make it happen, right?
So you mentioned data quality, and I think a lot of our attendees are interested in that, and the idea of using meaningful data. We have a bias. I think people attending are mostly in the computing information science community, where judging the quality of data and the deficiencies in the data is hard. So can you expand a little bit on what you did to make sure that the data you're using is meaningful or the right type of data, or adjust for the noise and things like that?
Right. I think that's a great point, and that's a part of a big part of what we had to also make it to do, especially when you use data-driven methods. You need to be careful about making sure propagating this uncertainty correctly in your methods. So I think so there are different levels which I think we converge to. There might be other solutions too, right? So one of them was being aware of what the data means, I think, and that's where our exposure and training in so a lot of my students are also trained in epidemiology. I think knowing about what it means epidemiologically is very important, right? From a domain perspective, what the data represents and what it means when you're trying to use it. On the other hand, from a computer science perspective, we use a lot of techniques, right? And I thought non-parametric techniques was something which was really useful, because that reduced the number of assumptions, prior assumptions which you have to make on the data set. So I think there is a lot of value in exploring the non-parametric ideas to make to handle noise and data and data problems. The third thing we did was also involve human in the loop, right? Like I think there is a lot of, especially for a crisis situation where you need to produce results basically every day or every week, right? On a schedule, on a deadline. I think it's very important to have a human in the loop to understand, right? And then make a quick sanity check and understand the lineage of your predictions very quickly. And I think, so for that, you need to build good dashboards or software, right? Or visualization things, which makes their job easier. So, so we did a lot of that too, right? So that people can understand and the analysts can drill down the predictions very quickly. So I think that's also an important part of this. And I think the final thing was, I would imagine that, again, I think like when you are in a crisis, sometimes easier solutions work, right? So you should be open to like something which can at least give some sort of explanation. So like we use simple techniques like ablation, for example. So just to make sure that, and they can be quite powerful, right, in day-to-day situations. And then think about like what kind of more sophisticated methods are needed. Like, so, I mean, literally it was like we used ablation. We realized the problems when we were trying to explain. It also gave you a lot of nice insights. For example, like we found that initially mobility was very predictive for our models, but then in the middle, mobility didn't become that predictive. It was not very useful because people started wearing masks. So just mobility was not enough to capture a lot of things going on. And so that's where we realized that maybe more sophisticated methods are needed, right, to explain and understand the quality of that data. So yeah, I mean, I really think of this as a loop. It's not like you do it once and just leave it, right? It's like something you need to be involved in and then iteratively improve your models.
Yeah, thank you. Dr. Bharti?
Yeah, Yeah, so I think I'll go back to a couple of things that Roozbeh said, so it's a shame he had to leave, and I'll highlight something that Aditya said. So in every pandemic, including this one, we tend to see that the underserved and the underrepresented populations are the hardest hit. We see this literally every time there's a natural disaster or a pandemic or any kind of outbreak. These underserved populations are chronically underserved, and they're underrepresented in a lot of ways. So they're underrepresented in the data that we use and that we have that are convenient data sets that are easy to access. And so they're underrepresented in our existing solutions. And I think Roozbeh made that point very, very well. A lot of what we found is that they're either absent or so badly represented in background data that we actually have to go back to square one to collect and rebuild those data sets to actually make sense of them. Things like existing maps of areas are pretty insufficient for a lot of small rural populations, for populations in low-income areas and low-income nations. Internet-derived data or mobile phone-derived data can be inadequate for those populations. A lot of the assumptions that we make when we deal with data don't represent those populations very well, whether it's what kind of questions we're asking and how we're using that to find solutions. So, for example, if we go back to the issue of rural populations that Roozbeh mentioned, we often ask how we can get people to healthcare centers. And in some cases, we might be better off asking how we can bring healthcare to people. And that is an issue in very sparsely populated areas or remote regions. So having some understanding of what the data don't show us, whether it's data on populations, data on diseases where surveillance is poor, or data on some of the things that we use to derive and implement solutions, understanding what our data don't show us is often where we get stuck with that last mile of these hard to reach, underserved populations. And that's where we see a lot of health issues really linger. They can also be places where health issues, and particularly spillover diseases, can erupt and then impact the rest of the world. We've seen that happen before. But essentially, we really need to focus our questions and our solutions on those populations, not so much as an afterthought, but really as a primary focus, because again, repeatedly, these are the populations that are the most impacted by adverse effects. And so that's one of the things that we went back and did with some of our tools, was go back, rebuild data sets, and develop tools to highlight some of these populations. For example, we had started looking at movement and contact data with mobile phone derived data, which is a very sort of low-hanging fruit way to do it. One of the reasons that that's important is because early in any infectious disease outbreak, that's one of our targets, right? So that kind of behavior is one of our targets because movement and contact drive transmission, right? So when you have susceptible people contacting infectious people, that's how you get new cases. And that's really what we try and cut off as much as we can early on, particularly for pathogens where we don't have pharmaceutical interventions, like a novel coronavirus. So when we do that, it's actually very difficult to track. It's hard to understand how people are taking up new behaviors or what compliance is with behavioral interventions. Whereas if we have pharmaceutical interventions, we know how many drugs were distributed, we know how many vaccines at least got to a place. And so we were trying to assess compliance with behavior and behavioral restrictions using mobile phone data. But we found in rural populations that wasn't really working. And so we switched to traffic data. We started looking at the number of cars on roads, and we found that was a much better match for representation for the populations we were looking at in those areas. But that wasn't a great match for populations like college campuses or urban areas where people are much more likely to be on public transit or on foot. So we just found that we had to tailor our data and our questions and our solutions to our populations. We could use AI across the breadth of that, but we had to know what we were asking. We had to know something about the populations to be able to understand where they were at and how that was different from where they were before the pandemic, and assess what level of behavioral interventions had been taken up by these populations and how well those were working. So if we tell people to stay home and they either don't stay home, or they do stay home but doesn't actually cut off transmission, then we need to reassess our messaging and our behavioral intervention tactics.
Yeah, thank you very much. And follow up on that. Since this is a panel, the conference is on AI in a post-COVID world. So what are the lessons that you have learned? You said that you had to go and rebuild the data, and you had to look at other types of data. So going forward, if we want to be prepared, what should we be doing that we were not doing before? I know we have a lot of health-related data that we collect, and there's an infrastructure. What would you like to see? I mean, I think everyone understands and wants to serve the underrepresented populations and minority, almost everyone, let's say, and then rural areas. There is, of course, an issue of cost effectiveness and so on. And but as you said, that if something breaks out in the rural areas, it's going to affect all of us. So in some sense, the cost perhaps doesn't matter for certain types of things. So going forward, what would you want us to do with respect to public health data that we collect that we have not been doing before, and what should we change?
Yeah, I think there's, to my estimate, two critical things that we want to always be doing that we kind of let lapse sometimes. And one of those is understanding and mapping populations. So we have to know the denominator. We have to know how many people are in an area, if we can even interpret what disease surveillance means. So if we see 3 cases in a population of 10 of something that's an infectious disease versus 3 cases in a population of 1,000 or 1,000,000, we're going to react differently. We're missing the denominators on a lot of sort of, I don't want to say invisible, but undermeasured human populations. And I think that's a big factor. So how we're allocating resources to those populations is probably inappropriate. And that includes things like health surveillance. So a lot of times our gaps in public health data and pathogen surveillance will match up with our gaps in census data or population measurements. And so those matches in data gaps end up hurting us twice almost. And I think Matt Ferrari has done some work on this, but really this idea that your disease surveillance in areas where disease reporting is poor can be very misleading and damaging. And those are often the places where we also have gaps in other types of data.
Yeah, so let me just, and I'll add to that, and I'll actually echo back to I think a common refrain from Dr. Bharti, which is that from generally speaking, when an outbreak starts, we start collecting information, right? We actually, it's the outbreak is the trigger to start collecting information, right? And we learn a whole lot through that process. But unfortunately, that's actually by that point, it's too late to detect changes, right? The refrain in the crisis management and outbreak response world is time is of the essence, right? The faster you can detect a changing signal, the faster you can detect a system that's out of regulation, right? The smaller will be your response, the more cost effective will be your response. But if you don't know what normal is, if you don't know what baseline is, right, then it's really, really hard to detect that changing signal. It's really, really, you have to wait till the outbreak is so big that it's obvious. And by the time it's obvious, it's oftentimes too late to contain it. And I think this is some, Dr. Bharti's done some really nice work looking at tracking human movements, using remote sensing to measure where people are going, how populations are changing, et cetera. Some of the work that I've done has been in the collection of routine surveillance, routine clinical surveillance for boring things, right? And if we know what those baseline levels are, then we might have an easier time detecting changes, right? If you think to the first detection of SARS-CoV-2 in Wuhan, China, right? It wasn't that somebody came in and a doctor looked at them and said, wow, you have a brand new virus, right? What they did was they said, well, this person has a pneumonia and I'm going to treat them. And it's not responding like a typical pneumonia and the treatment is failing. And then somebody else is coming in with another atypical pneumonia, right? Every new outbreak is going to start with a misdiagnosis by a clinician. And that's by design, right? If the clinician's not doing their job wrong, by doing that, they come into work every day with a prior perception of what common disease is going to be. And it's only when that common perception, it's only when that prior is overwhelmed by the evidence in front of them, right, that we notice that something new is happening, right? And I think we worry so much about detecting the novelty that we don't think enough about building up the data and the background necessary to be able to challenge that novelty, right? We want to look at that novelty as a change against baseline. And that's how we're going to be able to detect things really quickly. And I think that's what's really critical. So going forward, right, the emphasis really needs to be on building surveillance systems, not just collating the existing data that's coming in, but actually building surveillance systems that are intentionally gathering data, that are intentionally being efficient in gathering these signals, and we can use the experience of the past to help us guide in the building of those systems so that we're better prepared going forward, not for the next SARS-CoV-2 outbreak, because we already know what that looks like. What we need to be prepared for is the next thing that's coming that we don't know about, right? Because again, that's the really hard thing, and that's the thing that's going to catch us off guard.
So I think one of the I agree with you, but in the I'll just push back a little bit using an adversarial argument. So one of the things that we have to make sure, apart from the cost thing, surveillance systems, the cost is getting cheaper and cheaper. But there is an issue of privacy and safeguards to whatever norms that we have. And how do we do that? How do we balance those? Any comments on that? Anyone?
I'll push back quickly on the cost argument, because I do think
Sure.
that routine surveillance and routine monitoring of health information will help us be more efficient and allocate resources during non-pandemic and non-crisis times, right? So I actually do think it is likely to be quite efficient. Dr. Bharti mentioned some of the work that I've done on disparities in detection rate of disease, right? I do some work with the US CDC and the government of Nigeria in monitoring childhood infections. And we know that childhood infections are much more prevalent in the north of Nigeria, which is a much lower income region, right? But if you look at where the vast majority of cases are reported, if you only count the reported cases, they're mostly in the south, where there's much more wealth and there's much more access to care. So if you went and looked and said we should go where the cases are, right, you'd be going to the places that are already better served, right? So actually, so improving surveillance systems and at least understanding how they work and how we can translate them into true burden would allow us to do better allocation of resources and better allocation of effort, even in peacetime and non-pandemic time. So I think that's the cost argument, right? The privacy argument is actually outside of my wheelhouse. So I'll let other people comment on that. I do think that it is possible to do this kind of syndromic surveillance in ways that are information rich at the population scale, but not necessarily at the individual scale.
I would agree, that I think these systems that we build, we possibly should have ways to safeguard the individual identifiers and then, aggregate them so that the population level things are taken care of. However, once we go into underserved and underrepresented communities, so if you have rural communities, then the number becomes much smaller. And then preserving the privacy, where in a town there are 5 people, but while as well as reporting things, is a tricky technical challenge, at least for those of us computer scientists who work on privacy. So I'll leave that as a comment. Anyone wants to add anything?
I will say that one of the most interesting papers that preprints that I've seen that's come out this year came out of, and I apologize that I can't remember the student who led this, but it was out of Shweta Bansal's lab at Georgetown, which was looking at routine surveillance for influenza and aggregating into regions, right, that are epidemiologically similar. So coming up with aggregates that are meaningful because they have consistent dynamics, rather than aggregates that are meaning because of political boundaries, which may not necessarily reflect what's going on. And that phenomenon is actually really interesting because it gives you an information-rich mechanism for aggregating data, de-identifying, right? That doesn't necessarily, that still respects the consistency in epidemiological dynamics, so it would actually still be quite information-rich.
Mm-hmm. Aditya, you were saying something.
Yeah, I mean, I completely agree. I think, and I take a broader view of the baseline. I mean, I think the baseline has to be from the data perspective. I think definitely you need to build baselines, but it's also in terms of models, and also in terms of personnel, right? And what I've seen here is that all the things which was built before was repurposed, right? And it's and so if that was not there, then you would not have been able to do that. So I think it's very important to have that. Like, for example, let's even say the ILI net, which CDC does. And at the beginning, when there were not enough COVID tests, a lot of people use that as a signal for a rough idea of if there is some uptake, right? And when there's an injection in the US. The other part about privacy and cost, I'm very optimistic because I think the past year has shown that when there's a crisis, a lot of these barriers go away, right? And people find solutions. Right, like suddenly a lot of things are available online. You can share with each other. People are willing to collaborate, making the red tape go away. So I think it's possible, but sometimes it feels like you need a crisis to make that possible. So it would be good for things to be like that, even when there isn't a crisis. And a lot of it has nothing to do with, even maybe a cost of or new technologies. It's about like just standardizing definitions. Like, I mean, when I remember when we were trying to look at hospitalizations, I mean, every state was reporting their own definition of new hospitalizations, right? And so these are the kinds of things, if these were all standardized, I think, right, I think that would make a tremendous difference for someone, again, from speaking from an AI and computer science perspective, we have seen great leaps, right, in other fields where there were standardized data sets and standardized availability to everyone, right? And I think if that kind of thing, if that's available in this space too, I'm very positive that there will be more development very quickly.
Yeah, I mean, on that note, and given that, how much time do we have left? We have about half an hour and a bit left. I will sort of shift gears to let's talk about the future. What would you like seeing from the AI community, and what do you think are the most important challenges, exciting problems that the AI community should tackle, and any thoughts on that?
I'll jump in here. I think going forward, I think Dr. Prakash made a really important point. We tend to sort of be more willing to give away things that we might protect, particularly along privacy lines during times of crisis. And this is a really dangerous precedent, right? So we saw this happen with DOD and Homeland Security after 9/11. We saw this happen with some private health information during pandemics. We can think back to Ebola, we can think to COVID-19. We have to be a lot smarter about this. I did some work with the ACLU at the beginning of this pandemic, really to protect individual information and privacy in spite of this crisis, because there are ways to do the work we need to do without violating people's privacy, because once information is out there, like you said, it gets repurposed by default or by convenience. And so you don't get to take it back when the crisis is over. And you also have a hard time getting those rights back once the crisis is over, because a precedent has been set. So if we go back to a couple of things we said just in the previous question, understanding variation from baseline is something that we need aggregate data to do anyway. We don't get a lot of extra mileage out of individualized data in those early stages. So really focusing on creative and meaningful ways to aggregate data that are informative and that still respect privacy. I think moving forward, that's going to be not only important, but that should be a priority for us. That should be a goal.
Yeah, I can add to that. I don't have any experience in the realm of public health data, but in the company we do work with various kinds of patient level data, including individual genomes, which, as you can imagine, that there's nothing more personal than your DNA. It's immutable. It is literally the blueprint of who you are. You can't change your genome if you've decided that was the right thing to do. And so the point about, what can you do with this data in order to come up with a conclusion about it, like what do these segments of the country look like, for instance, is a really good way of then taking away the personal aspect of it until you get to that point. I guess what we have built up is a system where we imagine that all of this low-level data would always be kept forever. We've got the storage, we've got the capabilities, we've got the technology. And with that, there is this idea, you give away your data and it could be used in all kinds of different ways beyond what the initial intent was. And that will bring sort of increasing sort of trust issues with it. So one thing that we probably have to get more comfortable with is the idea that you would give data temporarily and then it will be transformed into something new, and then it will be removed. And there have to be systems in place to guarantee that, so that people can trust giving essential data over at the time of a crisis. But when that crisis is over, do the people in charge of it still need to have all of that, or are the conclusions reached from it enough? And I think we need to move closer to that place where people can trust these things in the crisis situations and know that it isn't going to be a one-way ticket for their data being available forever to other people.
Yeah, I think there are two concepts that I've run into over the last year and over the last many years. So one is the idea of minimally sufficient data, right? So just it's as much as you need, but not more, right? And I actually think that trying to figure that out and work that out is a really good use of time after a crisis. If you're doing a post hoc retrospective assessment, you say, we gathered all this data, we had all of this stuff, and we were working with it in crisis mode. Retrospectively, you can go back and say, how close to the best answer, how good of a job would we have done with less, right? And actually, and use that to try and prioritize what kinds of data elements are necessary to be able to do this. What are the sample sizes necessary? What kinds of resolution are necessary? So I think that's one really important concept, and I think it's going to be a really important thing going forward, because there will be this is the best recorded pandemic in human history so far, right? And I think there's a lot of opportunity to try and learn from that experience to come up with minimally sufficient systems so that when they need to be spun up again, right, they can be done so efficiently, and we're not just collecting everything in the hopes that it will be useful. So that's the first concept. The second, and this is admittedly something so I'm putting it out there to see if the rest of you are familiar with this, but is actually just working with synthetic data. And I'm not talking about simulated epidemics, but actually taking the real data set and creating a synthetic version of it that contains that respects many of the same relationships, many of the same dynamical relationships, but loses the individual identity and has appropriate randomness and de-identification. This, I think, is actually, I've been presented some of this through our statistics department. I know a graduate student who's working on this specifically for spatial location data. And it's a really interesting concept, because what you could do, right, as was suggested, you could take the real data that the owner has a stake in, right, and is concerned about sharing, create a synthetic version of it and distribute that out, right? And that allows you to get it out to many research groups, develop many different kinds of models, build systems that can process it, right? And then take the system back and run it on the original data set, right? So it actually so data sharing and data use doesn't have to become an impediment necessarily to rapid development and distributed development over many different research groups. I think one of the things that I've found in my experience in the past is that oftentimes, end users or subject matter experts will go to the group they last worked with because they already know them, they already trust them. And that's a good thing in many, many ways, right? But if you really also want to foster collaborative work and distributed work and get many different perspectives on this, you need to share your data more widely. And there are obvious costs to that. And I wonder if, a synthetic approach to synthesizing data sets and distributing useful but fake versions, might be a way to help speed that along.
So I love that idea. I have consistently struggled with an aspect of it, which is, so if we start with what you talked about with minimally sufficient systems, and we say, all right, if we go back to the beginning of COVID, the minimally sufficient data that we would have needed based on what we know now is something about probably direct contacts, knowing it's a respiratory virus, blah, blah, blah. The next pandemic might not be a respiratory virus, it might be something else. And if let's say it's HIV-17 or something, right? So we need different data and we need different minimally sufficient systems. So there's a great ability to learn what we needed for this particular pandemic, but then using that going forward, if we were to accidentally transfer a type of minimally sufficient data system or data collection system from a respiratory virus to an STI, we would never figure out quite what was going on. A lot of harm could be done and a lot of delays could be in place. And then that same idea transferred to the synthetic data systems, I think it's, and I think, you're talking about Adam and Ephraim's work right? So I think, and it doesn't, I won't get into the details of that, but I think one of the things that is easy to do retrospectively is say, hey, we had this outbreak, we understood the mechanism, we understood the transmission patterns that underlie it, and so we can create representative synthetic data. But in reality, when that's happening in real time, that's very difficult to do. There's a lot of transmissible infections and environmental toxins that look similar epidemiologically. If you look at the pattern of spread, the spatial pattern of spread, or the susceptible populations and the vulnerable populations, it can be very difficult to figure out what's actually important as far as patterns, and synthetic data sets that don't understand the mechanism because you're in real time can misrepresent the data in important ways and make it hard to figure out what's really happening on the ground. So I love that idea. I don't have the expertise to understand how one could create those data in real time accurately.
Yeah, and I would like to add to that. I think when you're creating this synthetic data, you're trying to preserve some statistical properties. And that means that you know what statistical properties to preserve. And maybe there is some, something in the data that some pattern that might be useful, something in a new type of virus or new type of disease, and now that may or may not be preserved by these means. So it works to a point. I think it might be useful if we come up with this, but understand that this is only for, the limitations of it, that this is only for viruses that spread through air, and so on. And for STIs, we would need a different type of model and so on. I think in the computer science community, there has been work on the earliest works in '93 or so on privacy preserving data mining up until the more recent differential privacy. And, you grapple around with this tension between how much can we hide and how much should we disclose. And there will, we'll have to design multiple solutions based on the different types of diseases and so on. Any other comments from anyone on this?
I think I would like to add maybe a couple of things to Dr. Bharti's thing as well. I think as a data scientist, it's very hard for me to say no to any data, right? Like if you give me, I'll take it. That's my answer. So, and also this idea of generative synthetic copies, I think apart from the privacy reasons, I think there is also a lot of value in it when you are dealing with data scarce situations, which is what we ended up doing. That I think there are a lot of statistical techniques as well, bootstrapping, like one simple one, right, where you can generate these things which can help you understand some aspect of your dynamical process, right, and your prediction. So I think, I'm very positive about the synthetic versions of data sets, because I think it can help with privacy, but also in actually improving and understanding your predictions and results. On the other hand, I think I'm more positive about like differential privacy, let's say, right? I mean, there are a lot of techniques now in computer science which try to take the entire data set and try to add noise and generate data sets which have reasonable utility. There are other techniques too, like federated learning, which are coming up, which can also, I think, tackle these kinds of situations where the data is distributed and you can push the computation to these different data sources without the data being really shared. So yeah, I'm in some sense, I'm positive that I think these are questions and there are solutions. And I feel looking at companies releasing data like Google, Facebook, right there, Apple, for example, they never released anything. I've talked to a lot of these people before the pandemic and they were very, very risk averse. But now it seems like, yeah, we can do this, and they have released things, right? So I feel confident that it is possible, but there will be work needed to be done.
Yeah, I'll shift gears to the other phrase that is in the title of this panel. But before I do that, I would like to ask the diehard attendees who have been here all day, if you have any questions, please feel free to use any of the raise your hand or type it in chat or in Q&A. And we will be very glad to take this discussion to answer your questions or to discuss different things. So the other part of the title in the panel was government response. And so I would like to ask the panelists to talk about what they think as government or governments across the world, what they think are things that we have done well, what we have not done well, what would you like to see, and the role of your work in informing or advising government response and so on, anything in those lines. Anyone who wants to go first? I can pick. Matthew?
I've worked with a variety of governments over time. Sometimes in crisis, oftentimes not. I think there's a lot of wonderful development in non-crisis times, and there's been really wonderful efforts in capacity building and training folks up. Communication is the biggest challenge in crisis. And communication and the best results in the world mean nothing if they don't come from a trusted source. And that trusted source, who that trusted source is varies around the world. It varies culturally, and I think that's I think that trying to build those relationships prior to a crisis is really, really crucial if you want to be helpful. I've seen a lot of really, really wonderful scientific work done this year that hasn't gotten the attention it needs because there's no conduit to get it there. And I've seen some very poor work get through and grab huge headlines and huge attention because it was already at the front of the line. So I think that remains one of the biggest barriers. And I think that for there's some questions here about students and trainees. I think for students and trainees who are interested in having this kind of impact in your career, I think you have to start as early as possible. You can't wait for the crisis to become relevant. You have to be relevant before the crisis, and that means you have to be investing in developing those relationships early on. That's not an easy thing, and there's no recipe that I can give you that will guarantee that will happen. But it is like anything else. It's something you have to start developing and training early on in order to be effective.
Maybe Olly, with respect to drug approvals and the process of taking a drug to market and so on, and your experience with government responses?
Well, as a software engineer, you're taking me well out of my comfort zone there, of course. But to Matthew's point about the early in relevance, I mean, that is something that applies both to us as individual researchers or companies, as well as to governments. When we started our work in 2020, our CEO, Joanna Shields, by the way, a Penn State alumna, she says hi. She asked, like, can we do something with this? And the only reason that was a relevant question was because we had spent the previous 5 years building up this data set about biology that allowed us to use it in the way that we did. And I think you could take that principle and sort of extend it further, because certainly with some government responses, there was a lot of preparation done for flu. And it turned out that we ended up with a different kind of virus for which these things didn't work. And so there must be lessons in there about what is the level of generality that you need in order that you can respond to these black swan events as we come along. Because if you look back to the Spanish flu 100 years ago, there's no doubt that we have so many more things in our favor than we did back then in terms of the technology and the monitoring and of all of the drug development and medical systems that have come out. And yet we have ended up in the situation that we have with the pandemic. And so some of that is around the preparation, and then the other parts around the way that governments would collaboratively deal with the situation that naturally passes, as we've seen so clearly across borders with such ease, where any differences in national response are quickly overwhelmed by the progress of a biological pathogen.
Thank you. Any of the other panelists have things to add?
I can add something that's quite obvious. Public health response can't just be public health focused. So I think that the government missed a lot of chances for economic supplements and stipends that would have helped bolster the public health response, because so many early interventions were behavioral. There were a lot of disparities in who was able to take those up and who wasn't. And there were a few stimulus checks that were sent out, but they were woefully insufficient for the people who needed them the most. So maybe this goes back to the issue of health disparities and inequities and underrepresented populations. But I do think at the heart of this, that those would have gone a long way, and that would have been money well invested with huge returns as far as slowing the pandemic early. So I think our government didn't do a great job of that, but I think that needs to be a really integrated part of public health response. And I think that there are ways to use AI to identify who the targets of those things need to be if you want to be picky, and not just blanket send out economic relief during times of crisis.
Thank you. Yep. I'll follow up on something that you said, Dr. Bharti. I'm just intrigued about the work that you did with the ACLU, and what type of things were they concerned about protecting privacy, and what happened to that, and how much of those protections do we have now and don't have?
Yeah, so that was interesting. There was, I guess because it was a time of crisis, a move for the authorities of Massachusetts to put in place high-resolution surveillance cameras in public spaces with the intention of facial recognition purposes. So they said that they wanted to be able to identify people who were not wearing masks in public. And that this was a necessary step forward, but there was no plan for the cameras to come down after the pandemic. There was really no need for that level of individual oversight in public spaces. And so I prepared testimony with the ACLU from a public health perspective that was not necessary, that was not going to be, it was not going to be useful. It was not going to make a dent in pandemic control. And we did prevent those cameras from being installed. But at this point, I feel like there's a little bit of a slippery slope where, you know, there's a chance that they'll go in for the next crisis or something. But that was the idea. It was really to protect people's identities in public spaces. And, you know, one of our biggest concerns was those algorithms are so bad at identifying individuals who are not white that, you know, we really felt that if you're doing this for punitive measures, our Black and brown populations are going to be, you know, getting tickets or punishments for not wearing a mask when in fact they've just misidentified people anyway. Even with correctly identifying people, that was not the best way forward. So we put in a bunch of arguments for why not to do that.
Yeah, besides using that data for other things, which is not.
Well, that was the point, right? So it was clear that the data were going to be given to law enforcement. And that was a huge problem. We didn't want the police to be able to sort of, yeah.
Yeah, thank you. And so I would be remiss if I don't get the chance to ask you this. So I'll ask each of you. And what keeps you awake at night? Either related to AI, abuse of AI, or related to the pandemic, or related to government response to the pandemic, anything in a related thing that we have talked about. What is the most scary thing or the worst thing that would keep you awake at night? Let's go with Aditya.
That's a tough question, Prasenjit. I guess sometimes I'm just too tired, probably. That's what keeps me awake. But I think for me, I think I'm a scientist at heart. So maybe the research questions, which I think this has thrown up, but I do worry about, like, I mean, we talk of this as a once in a century pandemic, but I think there is, I mean, I believe there is a sense that may not be that uncommon, right? Like in the future, if we don't do some things right. And so I think that's something which also drives and energizes me in terms of like some of the unsolved problems, that why working on these things are important, right? I think for a long period of time, when there was no such obvious, in the popular imagination, the pandemic was not very clear, right? I think people probably didn't understand the value of some of this work. And I feel that has changed a lot. And I think that's good. So, yeah.
Thank you. Let's go to Olly.
Well, I guess before we get to the scary things, it's also worth to think about some of the positive things as well. Certainly over the last year, the rapidity of responses in some cases has been amazing and so far beyond what you could have expected or what the norm was before. In the case of the drug repurposing for COVID-19, we published that in February, and it was already being used in some trials in March, which is an unheard of pace. And then it reached and passed through a phase 3 trial in the same year, when typically this would have been a 5-year exercise, including for the vaccines. So many vaccines which were created, approved, and then delivered within the scope of 2020 is an astonishing thing. I guess in a case like this, you open up all kinds of possibilities to do amazing good, but also to do harmful things or things without proper thought. To the point around a well-intentioned but flawed idea of finding people with masks on a camera, and the fact that you can do that, you could build that technology within the scope of days or weeks, when before you wouldn't have been able to do so, is a remarkable thing. I guess the concern there is then where do these things go wrong when you don't have enough time to really think out the consequences for them? And then to the point that we've touched a few times around sort of the data aspect of it and the privacy implications, etc., of that. There's a lot of stuff that's sort of predicated on this notion that more data is always better. So whatever it is, the algorithms are hungry for more, and so we must find it. And that leads to some sort of interesting ways of people collecting data or hoarding data or building up these things. And that is worrying because that also leads to unintended consequences or strange circumstances. And so certainly from an AI or a machine learning perspective, it would be really good to tackle that approach of the more is more is not necessarily the way to go. To take the adage of like, I've never been hit by a bus, but I didn't need to get hit by a bus a million times for me to figure that out. There has to be something in the actual technology that we build that makes it less hungry for data and less likely to lead to unintentional uses of data or abuses of privacy or unintended prejudicial things that can happen as a result of that. And I guess in any situation where there's a crisis and a fast-moving thing, the opportunities for things to go wrong unintentionally are always there.
Thank you. Nita?
Yeah, well, thanks for that uplifting tilt on it. I think we needed that. I think one of the things that keeps me up whether we're in a pandemic or not is, you know, I'm sure everyone on this panel gets requests from journalists to comment on things all the time. And as we near the end of this pandemic, and as we near the end of the Ebola pandemic, and I guess that was an outbreak, as we, you know, have gone through several cycles of pandemic influenza and things, I think that the question that I get asked the most that is really frustrating, that is what keeps me up at night, is what have we learned from this outbreak that will help us in the future? And it's always the same thing, and it's never a lesson that we learn for long enough to keep it up. And it's the point about health inequities and disparities. It's always the least resourced populations that are considered sort of the last mile that bear the brunt of all of these outbreaks. And really just shifting our perspective to make those populations the first mile would have such a huge public health benefit as far as reducing transmission, reducing the sort of length of tail of these outbreaks, and you know, minimizing the early growth of these exponential transmission patterns. That really is, I think, to me, the thing that keeps me up at night. We keep missing that lesson. We keep failing to act on it in meaningful ways, and we keep making the same mistakes around that. The other side of that is, I think, something that Dr. Prakash kind of mentioned, the issues of scientific communication, and something else about, I think that Dr. Oeschle mentioned about the speed of information. Now we see the speed of misinformation at the same rate. So we see misinformation, political propaganda, politically leaning information that is being distributed as if it is scientific information. And that is having a huge impact on the decisions that people make in their own health decisions, their own public health decisions. And you know, we're coming up directly against that with COVID vaccination coverage. We can have the best vaccines in the world available at no cost in abundant supply, but if people choose not to get them, we cannot get ahead of pandemics. And so that is another part of this problem that we really need to get ahead of, just understanding misinformation and understanding how to help people distinguish between different types of information, different qualities of information.
Thank you very much, Dr. Bharti and Dr. Ferrari.
Sure. So I'll come back to the good news, bad news approach. So the first, so absolutely the rate of innovation and concept to product to market over the last year and a half has really been staggering and has been really impressive. There's been huge efforts to remove barriers to sort of maintaining regulatory and approval rigor, but removing the bureaucratic roadblocks that have kept things from getting to market quickly, and as well incentive schemes, collectivized incentive schemes like COVAX for getting things to market. I mean, they're still lagging behind. Vaccination is still lagging well behind in low income countries, but it will. The COVID vaccine will reach those countries much faster than it would have had those schemes not been put in place. So I think there's been, again, this move towards technical innovation has been fantastic. My concern builds off of that, though, and I think that we have a long history of focusing on things as solutions rather than systems. And I think that, that we have this perception of there will be a drug, or there will be a vaccine, or there will be a test, and that will be the thing that saves us. And I think we've seen consistently throughout this pandemic that is not the case. There's been a massive increase in surveillance and diagnostic capacity, in the U.S. specifically, to the where now everybody in the U.S. knows what RT-PCR is, and you can get a rapid diagnostic test at the pharmacy down the street, right? But absent systems to provide for people to act on positive test results, the test is not helpful, right? If you have a positive test result, but you still have to go to work because you can't take time off because you can't feed your family otherwise, right? The thing is really important. The thing is a part of the system, is a part of the solution, but absent the system to support that, absent the system to support good behavior, the thing is useless, right? A vaccine that needs to be stored at -80 is not as easily distributable and can't be distributed in as many locations. There's been fantastic news, I think news headlines over the last week of Johnson & Johnson vaccine being delivered in subways in New York, right? Because it's a one dose delivery. You only need to contact that person once, and it doesn't require a strict cold chain. So that's fantastic. That's a product profile, right? That works with that opens up a lot more opportunities, right? And so so we really need to be thinking about not just developing new stuff, right? But the systems in which we need to place those things and to be building those things at the same time. Waiting until you have a product and then trying to make the whole square or circular afterwards, right? That's not what we need to be doing. We really, I think that in order for us to be able to capitalize on that innovation rapidly, right, we need to be thinking about the market. We need to be thinking about the end user. And we need to be thinking about the system that's going to get it out there. I think that the same is to be said with production and supply chain, right? We have a great idea, but if we can't produce it at scale, or we can't produce it distributed around the world, or there's only one producer in the world, or the boat has to squeeze through the Isthmus of Suez, through the Suez Canal, right? I mean, all of these things, we've seen the systems fail so many times this year, in almost in comical ways at times, that I think we really need to be thinking about building systems that are equitable and that are redundant and that are resilient.
All right, thank you. I see that I have 6 minutes left, so I'll dole it out 1.5 minutes each for our 4 panelists. I see that I have one question that I have left, as well as a closing statement. So this will be a 3-part question. So 30 seconds each. What are the top 3 to a few things that you think we can do in order? We have heard again and again about limitations with respect to not reaching underprivileged communities and the weakest in our society. So what are the 2-3 things that you think we can do as a society? Hopefully one of them you can reserve for AI researchers as to what AI can do, and any closing statements that you would want to make. So let's go with Dr. Prakash.
Sure, Prasanjit. I think that's a very important question. I think for the first part, I would say as an AI researcher, I think we need to build more high resolution models to account for the heterogeneity and variance in the population. I think we right now try to focus on very aggregated and average case kind of analysis. And I think we need to really go deeper and more finer grained models about, and I think there's a lot of new AI to be developed for that. And we kind of do that every day in, for example, in advertising, right? Like AI churns through a lot of data sets and tries to personalize the ads to you, right? But I think for public health, healthcare, I think we are still a way to go to develop that level of high resolution models. So that might need I think a combination of new data collections, a new way of thinking, and also like new technology, right, in terms of model development from AI. I think closing statement. I think I'm very excited and happy to be here. I think, and this past year has, I think, taught me also, I think, humility in terms of what we can solve and what we cannot, right? I think I hope to take these things into account to have a bigger picture, right, and and also rethink about our impact on the world, right, about the way our work can impact in very sometimes the most mundane work I did had a bigger impact, right, because it's very funny, and and I think that gives you a sense of like a longer term perspective of, right, what might be more important. And yeah, thanks.
Thank you very much. Dr. Oeschle.
Yeah, on the top things we could do, I think it's worth to come back to the topic of diversity in data, which underlies so much in the area of science where Benevolent works. There's a lot of experimental data, cell models that are derived from white males in their 30s that look a lot like me. And then there's a whole other populations out there that could be underrepresented. And of course, that means, whether or not it means to a different outcome scientifically, this adds up to the feeling of distrust that, these things were not designed for me. And, in the case when you need to vaccinate the whole world, what could be more important than to convince people that it indeed has been tested on people exactly like you. And so that stuff takes time to set these things up, etc. And these are things that we should learn now so that we have a more diverse basis for doing scientific experiments in the future, for whatever that brings to us. When it comes to any closing statements about AI or machine learning, I guess my point always is that AI, machine learning, or statistical analysis is just one tool. Which is, to Matthew's point, is probably part of a wider system, and it's worth to think of it in those terms of how it can be used in that way. Very often, AI is sort of pattern recognition, which inherently is, you could say, is looking at the past in order to see what the future would bring. But to those points around systems thinking and how one human can hold all of that stuff in their head, maybe they can't. There's a great deal of possibilities in there for different flavors of AI that are more sort of executive in their nature and more focused on understanding how all these things work. So there's a lot of very exciting things that can be done in the near future.
Thank you very much. Dr. Ferrari.
Sure. Wow, the top three or the top two is it's so hard. I think so. I mean, really, I'll come back to, I think that centering humans within with AI and machine learning is absolutely critical. Thinking about AI as a product, and a product needs a consumer, right? And I think that's so AI research, we need to build not just capacity, more people that can do the stuff, right? But we need to build a culture of use, a culture of critical thinking, a culture of interpretation, a culture of translation from technical results to to a subject matter expert that can enact policy or change based on the results that are coming out of these things, right? And I think that that's really what we need, that we really need to make sure that humans stay deeply centered in these things, and that they're intended for human use, and they're built around human use. And I think that's the way that we can make these tools much more effective, more rapidly adopted, right? And again, for crisis response, right? I'll come back to it again. Time is of the essence, and that's not the time to try and teach the end user about the cool new thing, right? They're going to use the thing that they know. It's in the interim, in the non-crisis times, where we have to build up that culture and build up that capacity, so that those tools can be at the ready when the crisis comes.
Yep. And the last word goes to Dr. Bharti. I'll remind you, because I'm interested in knowing your thoughts. The first part of the question was that what can we do about these underrepresented communities, and the 2 to 3 things, and then anything in general, please.
Yeah, so I'm going to echo some things that the other panelists said. If we start with the question, how do we improve AI for underserved or underrepresented populations, I think we actually have to back up a little bit. And the question is, how do we improve the data that go into AI to help the results of AI techniques serve these underserved populations? And we talked a little bit about, understanding baselines and going back to non-crisis times of data, and really going back to basic data sets and building those up in a way that are much more representative, so that when we bring in AI tools, whether it's during a time of crisis or not, it's working with something that doesn't start out super biased. And then after that, I think all the panelists made some good points about, making sure our AI algorithms are not biased, and bringing in different types of people and processes and end users into that whole thing, into all those algorithms and the development of them from the ground up, and not trying to retrofit sort of solutions onto something that's already got biases built into it. So I think those are my 2 or 3 points about AI for underrepresented populations. I can't remember the second half of the question.
Closing statement, please.
Oh, so I'm going to do the closing statements for everybody, I guess, right?
Sure.
This has been fantastic. I definitely learned a lot from all of you, hearing your perspectives from different fields, and how you had different problems to start with, and you came up with different solutions, and how they all work together, I think really drives the point home that there's not going to be a single solution to any crisis, whether it's a pandemic or something else. These are problems that we have to solve with systems, and systems have to communicate across disciplines. AI, economics, epidemiology, anthropology, sociology, and obviously politics. We have to get everybody on board to put together robust systems that will serve everybody when we need to call on them.
Thank you very much. It has been a great pleasure. It's a fascinating conversation. We could possibly go on for an hour more or more, but we will have to stop now. I would like to thank all our panelists here, and all of our audience for coming to this panel.